Hi, welcome back to my channel, and if you're new, my name is Marie. Welcome. I'm so glad you're here. Today's video is going to be a little update in regards to my mommy makeover. I mentioned that I had decided to get a mommy makeover done, and yesterday it was a busy day. I had 3 appointments that had to do with my mommy makeover, and I just wanted to give you guys an update. So yesterday, my first appointment was at the main hospital. I had to get some blood work done, and I got there around 8:30 in the morning, and I didn't get seen until like 9:45. Yes, I waited a long time, but it is what it is. They took 1 tube of blood, and then they brought me to a different room, and a nurse went over some rules and things that they wanted us to do on surgery day, like me and my husband, where to go when we get there, where to park, and all that stuff. After I was done there, I headed to the surgeon's office, and his office is kind of attached to the hospital, and that was one of the things that when I was looking for a surgeon, that was something that I wanted, just for safety, and of course in case an emergency happened during surgery. So I walked to his office, and as soon as I got there, they took my temperature, and I was there for my COVID test appointment. She took my temperature. I paid $26. I didn't know they were going to charge me for the COVID test, but it was just $26. And she brought me into the room. She did the COVID test. And then she was like, since you're already here, we're just going to go ahead and stay in this room, and we're going to do your pre-op appointment, your second consult in this room. So just go ahead and get undressed. So when the surgeon comes in, you can ask him whatever questions we want, and then we can go over the procedure and what you're gonna get done and everything. So I got undressed. I got undressed, and the surgeon came in. The last time that I saw him, I was kind of went blank and forgot to ask a lot of the questions that I wanted to ask. So this time around, I put all the questions on my phone, so I just went one by one. And he was awesome. We talked a lot about how scars gonna look. That's like one of my main concerns. I know doing this procedure, I will have different scars, the one in my abdomen and also the one around my breast. And I kind of asked him how is it gonna look, how, is it gonna be a straight line, how long is it gonna be? And he was just awesome. He also suggested that if I would like, next week when I go for my marking the evening before surgery, that I bring a bathing suit. He's like, bring a bathing suit that you really want to wear when you recover, so we can kind of use that as guidance when it comes to your scar, like how low you want it and all that stuff. So that's something that I'm going to do next week. We also talked about what my husband is going to do during those 3 to 4 hours that I'm in surgery. I will be staying overnight one night, because that's just his protocol. He likes his patients to stay overnight one night at the hospital, just to monitor them and keep an eye and make sure everything is going well. That's another plus for me. So they gave me a booklet, which has tons of information of what not to do and what to do prior to surgery. So sorry, I'm looking down because everything is in a paper. One of the things is, do not eat or drink after midnight the night before surgery. Do not take any aspirin medications, ibuprofen. The only thing 2 weeks before surgery. So I got a call from the nurse a few days ago where she also gave me this instructions. I said to do not take any diet supplements, vitamin E, herb supplements, or any fish oil, and do not change any of the prescriptions that you already are taking. I already started this past Monday, so I was aware of this. We also talked about my nutrition for the next few days before surgery, and also my nutrition for after surgery, which was very nice of him. And he also recommends that I increase my protein intake before surgery and after surgery. And I will be going to the store today to get some protein shakes and other things that he talked about. He also talked about hydration, exercise. He just wants me to do something for the next few days, which I've been already doing. As I mentioned on my Get to Know Me video, I love running. That's my way of getting my heart moving. So I already exercise, and I usually take the kids for walks and all that fun stuff. But he just wants you to get moving. And then one thing that I really loved about this booklet, they shared about mental preparation. For me personally, this is a big thing. And I have been doing this because I can be a person that I'm impatient when it comes to seeing results. And it happens to me when I exercise. I need to be kind to my body. I need to be kind to myself. I need to give grace to myself that I just went through a major procedure, and yes, I am gonna come out of that surgery looking a lot better than I did before, but it's gonna take time to heal, for my scar to start looking better. It just takes time, and I think me and maybe others too, we can be impatient with ourselves and our body sometimes. And this is something I've been practicing a lot, just getting ready for the surgery. I follow a lot of surgery groups, and a lot of the ladies in there mentioned that at week 2, you kind of go through this thing like, what did I do to myself? Why did I even do this to myself? Like, you go from really highs to very lows to highs to lows for a few weeks. So I'm kind of already preparing myself. My husband and I have talked about it, and he's just been very, very supportive and very encouraging through this entire procedure. So he's like, you have to be strong, you mentally, after we do this. He also suggested that I take some the protein that I already mentioned, and then he also suggested 2 other products that I will put the names on here because I am not even going to bother to trying to pronounce these. But they're supposed to help me while going surgery and also after, for the recovery. What else did we talk about? Yes, yesterday's appointments were a lot. I got home and I recorded a video, and I was just like, I could not concentrate. I had the worst headache. So I was like, I'll just do it in the morning when I wake up. And then here I am today. I'm just praying now that my COVID test and my blood work comes back okay. I kind of also been kind of preparing for the worst. But he said, my surgeon yesterday, he's like, don't worry about it. He's like, you look really healthy, and I think we're gonna be good to go for surgery on Thursday. I am so excited. Yesterday, it really kicked in that I have decided to do this. Like, I have been talking about it, I had made a decision, but when I was in his office yesterday, I tested my husband, and I was like, I am sweating, I am nervous, I am like doubting myself, like, do I really want to do this? It was but I'm just really excited at the same time. This is something I've been looking for a long time. As I mentioned in my other video, I had my belly like this since I was 15 years old because I had my baby girl at a very young age. And I'm just excited. I am excited for this to happen. My sister is coming in today to spend some quality time with me, and bringing my niece, and we just want to spend time together before surgery. And then my mom is gonna come in on Wednesday, the night before surgery. So I'm gonna have a lot of help, and I saw that in a lot of the surgery groups. You need to have help. You need to have family here to help you. And of course, my husband is also gonna be here. This is it for this video. I am so excited for this to happen next week. I am not sure if I will be posting a vlog next week, but I will try my best. I'm probably gonna have my husband try to record the day of surgery and all the fun stuff that will be happening that day, but we'll see. I want to see how I'm feeling. I'm not gonna make any promises that I'm gonna upload a video next Friday, but we'll see how I'm feeling, and then I'll let you guys know. I'll probably post little clips here and there on my Instagram, so you can, if you want, you can follow me on Instagram to follow this journey. And if you have any questions, concerns in regards to the procedure, just ask me anything down in the comments below, or if you want to send me a private message, just send it on Instagram. So that's it. I will see you guys next time. Next time I'll see you, I'll probably already have surgery. And if you haven't done so yet, please subscribe and follow me on Instagram. And that's it. Until next time, bye.